Morning and Vanakkam. Today we are discussing imaging of mediastinum. I am Dr. Nithish Yeslawath, Professor Radio Diagnosis. Here we go. Mediastinum is divided into three parts: anterior mediastinum, middle mediastinum, and posterior mediastinum. Anterior mediastinum is anterior to the anterior wall of trachea and posterior wall of heart. The line, which is not anatomical line, but it is like imaginary line on lateral radiograph. The same thing on the lateral radiograph, 1 centimeter behind the vertebral column, anterior margin of vertebral column, the line is drawn, and that line divides into middle and posterior mediastinum. Anterior mediastinum anteriorly is limited by sternum, posterior mediastinum is limited by posteriorly is limited by paravertebral gutter. Superiorly thoracic inlet and inferiorly diaphragm for the all these compartments. Here we will see few images. This is frontal radiograph on the left side and lateral radiograph on the right side. On this frontal radiograph, what we are able to see is that there is a dense area in the right cardiac region along with the right cardiac margin. Lateral radiograph here, overlying on the heart is a dense area seen. We'll see of the same patient, we'll see axial images. Here, upper to our CT scan images and lower to our MRI images. Upper left image is axial CT scan image with a contrast, and upper right image is axial. It's a coronal CT scan contrast image. In the lower side, the left side, E1 weighted image is there. On the right side, T2 weighted image is there. Now let's see about it. This is the lesion which we are seeing on radiograph. The lesion is mainly cystic, and the lower part here, what we see is a solid mass. So it's anterior to the heart on the right side. Here on the coronal section, we are seeing again the lesion where solid component is showing contrast enhancement. On T1 weighted images, the fluid content is seen as a hypo-intense or dark area. Same thing on T2 weighted images, the fluid is seen as a hyper-intense or whitish type of area. So this is these are the images, and these are the cystic thymoma. This is cystic thymoma. Next image we'll see. Here we are seeing three images are there available. One is frontal radiograph, and then another two are there, which are axial CT scans, axial contrast enhanced CT scan. Here we get to see dense area along the left upper mediastinum, and subpleural lobulated soft tissue is also seen in the left apical region, as well as along the pleura. Here on the cross-sectional image of contrast enhanced CT scan, what we are able to see is along the mediastinal margin, there is a soft tissue invasion is seen, as well as pleural margin. So next image shows enlarged thymus, and these images are of invasive thymoma. This is the case of invasive thymoma. Here we are seeing heterogeneously enhancing lesion. The solid component is showing enhancement, and the fluid content is not showing enhancement. The fat planes between vascular structures of the mediastinum, cardiovascular structures, as well as fat plane between sternum and the lesion is totally obliterated. This lesion is thymic carcinoma. Another case is here we are seeing again heterogeneously enhancing large lesion, which is encasing the vessels, which is infiltrating into the vascular in between the vessels and reaching up to trachea. So this is again a large soft tissue lesion. This is thymic carcinoid. Here, actually, these are 4 images, all CT scan and gel cuts. What we are seeing is A and B images are taken after these 2 images, after 6 months of it, after treatment, the C and D images have been taken. So A and B images show enlarged thyroid, including the isthmus. There is enlargement, and on the B's image, the thymus is also showing enlargement. So after treatment, radioactive iodine, that is I-131, after 6 months treatment, the thyroid also is showing much less size, as well as the thymus is appears to be much reduced in the size. So this is the case of thyroid toxicity, and this is actually thymic hyperplasia with Graves' disease. After treatment, it showed results. Next case we'll see. These are, first is a CT scan image. First is CT scan axial image with contrast image. Second is second to last 4th images are MRI images. Here we are seeing fluid density area on MRI. This is T1 weighted. What we are seeing is again hypointense area. Here on T2 weighted, we are seeing hyperintense. And on contrast MRI, there is no enhancements in this lesion. So this was thymic cyst. The area is a thymus area anatomically. In that area, the cystic lesion is seen, which is showing T1 weighted hyperintensity, T2 weighted hyperintensity, which goes along the fluid, which clear fluids will be appearing like that on T1 and T2. The same signals are shown here. And on contrast enhancement images, there is no enhancement seen. So this is thymic cyst. We are seeing here 2 images. These are frontal and lateral radiographs, contrast enhanced CT scan, and specimen. What we are seeing here is that there is soft tissue, well defined, bulge is seen on the upper mediastinum on the right side. On the lateral chest radiograph, again, same soft tissue is seen. On contrast enhanced CT scan, what we get to see is a complex lesion, mainly containing fat. Internally, there are some soft tissue areas. So, and on the specimen showing sebaceous content, this goes in favor of thymic teratoma. Cystic teratoma is here we are going a large heterogeneously enhancing irregular margined mass is seen on CT scan. The mass is displacing vessels. This is a large mass. Bilateral pleural effusion is seen, as well as atelectatic areas are seen in the lungs. So this mass is seminoma. Here, large mass is seen in the anterior-mediastinal region, which shows peripheral enhancement. A lymph node is also seen adjacent to it. Multiple metastatic lesions are seen, the involving both the lung fields, along the pleura in the lung fields as well. So this is metastatic choriocarcinoma. Here we are seeing again large soft tissue mass in the mediastinum. It is extending to the hilum as well, and encasing almost right pulmonary artery. So this is lymphoma. Here we are seeing multiple enlarged lymph nodes. The lymph nodes are showing calcification, high attenuation is seen in the areas. Here the lymph node is showing the calcified areas within, enlarged nodes, conglomerated nodes are seen. So this is these are calcified mediastinal nodes. These kind of conditions mostly sequelae of histoplasma capsulatum infection or metastatic lymph nodes can be because of mucinous adenocarcinoma. These are the two main important differential diagnoses for these kind of features. Next image, again we are seeing here along the, this is in the middle mediastinum. Here we are seeing centrally liquefied central fluid. There is a lesion. This is lymph node actually enlarged with central necrosis. So again, low attenuation lymph node. This is caused by histoplasma capsulatum. Here we are seeing normal thyroid in this image, and we are seeing here soft tissue mass large, which is encasing the vessels, which is displacing trachea to the right side, and there is a narrowing of trachea, mild. So this is Castleman's disease. Next image we are seeing. First two images are frontal view radiograph as well as lateral view radiograph. What we get to see is a trachea here, and here the origin of mediastinum bronchi is in here and on. So this is the lesion actually, very close to mediastinum bronchi and trachea. So here we get to see the lesion is well defined, fluid density lesion, close to, very close to, in a close proximity to right mediastinum bronchus. So it is a bronchogenic cyst. Another case where we see here a frontal radiograph. What is important on this particular radiograph is esophageal line recess is towards the left, it is pushed towards left. So it indicates lesion at the esophageal level actually. And next is a barium swallow here, where the esophagus is seen pushed to the anterior side. On cross-sectional imaging, the first image is contrast enhanced CT scan. Here it is well-defined fluid density non-enhancing lesion. Esophagus is displaced to the left side. So the lesion is arising from the right side of the esophagus, and the wall of the lesion is almost imperceptible, and this is esophageal duplication cyst. On MR image, esophagus is here. We are seeing the lesion. clear fluid density lesion. It is with the imperceptible walls. So this was esophageal duplication cyst. Next image we are seeing. Here, the large lesion based on mediastinum. Here, if you see on the lateral view, it is based on the spine actually, very close to spine and extending to the right apex. What is important finding in the on the radiograph is splaying of the ribs, upward displacement of clavicle. First rib is also upward and laterally displaced. So at some point here, there is a rib crowding also seen. So this lesion is causing deformity of the ribs. Spinal curvature also has got changed here, upper spinal. So this is actually plexiform neurofibroma. Next image we'll see. Again, the same case actually. MRI images. Both the images show large lesion. The lesion is close to the ribs and it is seen extending in the apical region. This is inversion recovery image. Or inversion recovery image, IR image, it is showing hyperintense appearance. This is again a neurofibroma. This is contrast in a CT scan image, axial image, and this is coronal image. This is MRI. What we get to see here is a large soft tissue mass with heterogeneous content. The lesion is seen encasing left subclavian artery, and here a very important finding here is left neural foramina is widened here. So it means the region has a connection, interspinal connection or intraspinal or neural foramina content. So this indicates neurogenic tumor. This is a neurogenic tumor. Actually, this was a malignant node-shaped tumor. Here we are seeing soft tissue mass adjacent to the left atrium, which is almost indenting into it. The soft tissue mass heterogeneously enhancing close to the left atrium, which is almost protruding or indenting the left atrium. Below two MIBG scintigraphy images are there, which are showing uptake. Intense uptake is seen here. This was paraganglioma. Next image, what we are seeing is two thoracic CT scan axial images are here. One is soft tissue window and next is a bone window. The first image, it's a contrast image. What we are getting to see is enlarged ribs are on the both images actually. Enlarged ribs are there with adjacent soft tissue there. The ribs are showing enlargement with altered trabeculation as well as adjacent soft tissue masses are there. So both the images show the same things. This is extramedullary hematopoiesis. Extramedullary hematopoiesis. Another case where we are seeing large soft tissue mass near the anterior mediastinum, near the upper mediastinum, on the axial image, it is in the middle mediastinum next to the trachea. The wall of the lesion, fluidic lesion, is almost imperceptible. The attenuation is fluid attenuation. Lesion is on the right paratracheal or anteroparatracheal region. The lesion is next to trachea. This is case of lymphangioma. Here we get to see very large lesion, heterogeneous lesion, mainly of a fat density. The lesion is seen compressing the trachea and displacing the aorta, aorta. On PET CT scan, it is showing FDG uptake in the soft tissue areas. Actually, the lesion contains mainly fat as well as internal septation and soft tissue is seen. The wall of the lesion is showing irregularity and nodularity. Some intramural nodes also are seen here. And these soft tissues showing very high uptake of FDG. So this goes in favor of liposarcoma of mediastinum. We'll see the next image. What we get to see here is a hypodense area in the anterior mediastinum. This is the case actually. You can easily see here. The sternotomy sutures are seen. This is a post-op case. And what we are seeing here is a soft tissue, fluid density area with enhancing wall, regular thick enhancing wall, soft tissue. Retrosternally, there is fluid collection with the enhancing wall. It indicates abscess formation, post-op of abscess formation probably. So this is large mediastinal abscess. Here the large mass is seen, which is showing calcified foci, and the mass is seen extending to the right mainstem bronchus, and it is encasing the right mainstem bronchus, which is leading to the constriction of the bronchus, as well as the trachea also is showing less volume, and this large mass is compressing superior vena cava. Here, this area, right mainstem bronchus is almost obliterated. Right pulmonary artery also is surrounded and getting constricted. Strictures formation is seen. Here, anterior mediastinum is showing collaterals. So these are due to SVC compression, long-standing compression. So this is the case of fibrosing mediastinitis. Here we get to see a lucent ring. This is a lucent ring is seen here, shown by black arrow on the lateral radiograph. This is a lucent ring is seen here. Actually, this lucent ring is around the pulmonary artery. Around the pulmonary artery, and it is seen as a lucent ring around the pulmonary artery. This is pneumomediastinum extending to the right hilum. So right pulmonary artery, around that there is a lucent area. So this is called ring around artery sign. Another radiograph where we are seeing continuous diaphragm, uninterrupted outline of the diaphragms Both the diaphragm look like a uninterrupted without any interruption. So this is called continuous diaphragm sign. This is again due to pneumomediastinum. Here are few images. This is frontal radiograph where mediastinum has lucent areas where we are seeing the lucencies are almost in a vertical position, traversing in vertical position. Uh, some lucent areas in at the root of neck as well. So this is pneumomediastinum on axial images of the CT scan. What we are seeing here is free air in the mediastinum. It is a case of pneumomediastinum. The important feature of pneumomediastinum is in between there will be vascular markings, septation lack of findings. It will not be in one clean go as we find it in pneumopericardium or pneumothorax. In the pneumothorax or pneumopericardium, there won't be any septation within or any markings within, soft tissue markings. So this is pneumomediastinum. Here on the frontal radiograph, what we get to see is a isodense area, almost looking like an extension of the cardiac left border, and the left cardiac margin is almost seen like a continuation next to the apex. Here the density area is seen on the lateral radiograph. What we get to see on the axial image, contrast enhanced image, is this is near the pericardium, anterior and left lateral to the heart apex. Fluid density area in the close proximity of the heart. Here we are seeing same thing in coronal images as well. So this is pericardial cyst. Pericardial cyst being very close to the heart without any in between content, both the soft tissue density areas. So the silhouette sign is there, and because of that, it is seen almost on the radiograph as a continuation of heart border. This is a pericardial cyst. What we are seeing, contour of the heart is enlarged and it is almost like a sac. Contour of the heart is enlarged. This is the anterior margin of the heart. If you observe, retrosternal fat is displaced ahead. It's called sandwich sign. So on the next MR image here, what we get to see is pericardial fluid collection. So this is pericardial effusion actually. This is cross-sectional image of the thorax. What we get to see is pericardial effusion. On this contrast study, the important feature here is pericardium appears thicker than usual and shows contrast enhancement. So pericardium is thick and showing contrast enhancement. It's a case of pericarditis. Here are the CT scan images here too. What we get to see is thick calcification seen around the heart and atrioventricular groove around the heart and in the atrioventricular groove region. So it's a case of constructive pericarditis where belt-like calcification seen surrounding the cardiac region, surrounding the heart. case of constructive pericarditis. Next image, what we are seeing here is the pericardium appears thick. There is a fluid collection with as well as thick irregular nodular appearance of pericardium is seen. Here in the next image, showing enhancement as well. Nodularity is seen, irregularity is seen, and thickening is seen. This is due to pericardial metastasis. Next image, what we get to see here is a nodular pericardial thickening. And there is thickened pleural region also that is extending to the pericardial region. This is the case of mesothelioma, which is involving pericardium as well. So these are the various mediastinal pathologies we saw on imaging. With this, we end here. Thanks.